My diagnosis was actually a fluke. I was in a clinical trial related to a different lung disease, and they were using CT scans at the beginning and the end to try to determine if there was any change based on the effect of the clinical trial. And my pulmonary doctor at that time noticed a change in the CT scans between beginning and end, indicated that I needed a biopsy. Had a biopsy, and they found a pretty significant tumor in my upper right lobe. At that time, they determined that they would do surgery as the primary way to deal with it. So I went through chemotherapy for a couple of sessions and then had my right lung removed. They were unable to maintain the margin between the different lobes on the right-hand side, so they took all three lobes out. Since that time, I've been, unfortunately, for the past 2 years, trying to find the diagnosis to a new mass in my upper left lobe, and that has been indeterminate at this point, so I'm not being treated currently. It's a shameful thing that we don't have greater attention to lung cancer in terms of the research dollars. When you look at the statistics for our mortality rate, it really is just amazing that we don't have more attention paid to it. And I think that's the issue for a lot of organizations, is that they need to do what LUNGevity does and try to, first of all, erase the stigma, or at least push it into the background, at the same time recognizing that without funding, nothing really will advance in the lung cancer world as it has in breast cancer and pancreatic and prostate and the other areas. I would mention LUNGevity as one of the key support groups for me. I did a lot of online research trying to determine exactly what was going on with the different treatment options that I had. And LUNGevity is a wonderful organization from the perspective of being able to provide information that we can use, not so much complicated, difficult to understand kind of information, but in fact things that are useful and understandable. So I really have a lot of respect for this organization and very glad to have that relationship. I've actually looked at a lot of different sources, both at our own hospital, but then looked at a number of the different online organizations. I think that some really do a good job of providing information, but the problem is sometimes it's so complex that we feel overwhelmed by the difficulty of understanding the language that they're using. And there's a lot of what we call med speak in there, things that are terms that we don't fully understand. Whereas I think LUNGevity does an excellent job of trying to communicate to all of us, no matter what our level is. And that's kind of the standout issue, I think, for them versus other types of organizations which are trying to do the same thing.